right, so we're gonna do a uniform check. I think we're good. And then you girls can go ahead and get started.
Throughout the last few months, my partner and I have had the amazing learning opportunity of learning about floating harbor syndrome. Floating harbor syndrome is a genetic disorder which is inherited by a bad copy of the SRCAP gene. Classic symptoms of floating harbor syndrome involve short stature, slowing of the mineralization of the bones, delayed speech development, and distinguished facial features.
When discussing floating harbor syndrome with Dr. Demsico, he gave us a lot of signs and symptoms that go along with floating harbor syndrome, including short stature, prominent joint damage, hearing and speech delays, vision problems, complications with organs like lungs and kidneys, and it can result in the loss of an organ, brachydactyly, dental delays, seizures, and facial features like a triangular face, deep-set eyes, and prominent philtrum.
Some of these features belong to a lovely girl named Madeline that we had the opportunity of meeting during this. Madeline is a sophomore in Pennsylvania and does not live the typical teenage life. A lot of Madeline's days have been spent in a doctor's office, maybe up to 3 times a week. At the moment, Madeline is only seeing 10 doctors, and they are working to make her life as comfortable as possible.
Madeline's mom, Joan, was told that she was 2 weeks behind gestation, 11 months after Madeline was born, and she was taken to the doctor where they found a birthing fluid in her ear, and as a result of that, they had to put ear tubes in, so that way it made life easier for her, and she'll always need them to drain her ears.
Madeline was also born with a cleft submucous palate, which required 10 surgeries to fix. During these surgeries, they also extended the lingual flap. As a result, Madeline was given a G-tube, which she kept for 5 years. After the G-tube was removed, she gained a lot of weight, and doctors are now working to help her become healthier. It was around the same time that they found out that Madeline was a dwarf. Doctors could not figure out what could possibly be wrong with Madeline.
So after countless doctor's visits, her and her family obviously had a lot of questions about floating harbor syndrome. So some facts and statistics about floating harbor syndrome is it's also known as Pelletier-Leski syndrome, and approximately 100 people have been diagnosed with it. And the name floating harbor syndrome comes from the first 2 hospitals that it was diagnosed at, which was Boston Floating Hospital and Harbor General Hospital.
Although there is no treatment or cure for this disease, there are ways to make people's lives more comfortable who have this. For example, they can go to many different therapies like occupational therapy, physical therapy, and speech therapy. They sometimes get a G-tube to help maintain their diet and dietary needs. Yearly testing is a big part of Madeline's life because she has to keep up with things like her eyes and her ears and all the other things that go along with this disease. Another thing that Madeline's mom asked was who else may possibly have this disease, which is where Nemours introduced her to some support groups like Floating Harbor Syndrome Support Group website, which is listed on our presentation.
So we would like to thank Nemours and our host advisor and Dr. Demsko, and especially Madeline and her family for sharing this experience with us and making it possible for us to do this.